Good afternoon, everyone, and welcome to our weekly meeting with our local health officials. And I'm Commissioner Tracy Brown. Dr. Beam from IU Health is to the left side of the table here. Mayor John Dennis from West Lafayette Mayor. Jeremy Adler, our County Health Officer. Mayor Tony Rosworski, good afternoon. And Dr. Daniel Wick from Franciscan Health is with us. I'll go ahead and turn things over to Dr. Adler.
Okay, thank you, Commissioner Brown. Good afternoon. Thank you for joining us this afternoon. As of today, the state of Indiana has over 35,000 confirmed cases of COVID-19 with just over 2,000 deaths. Here in our county, we have 421 confirmed cases. We are sad to report that we have our fourth death in the county. The death occurred in an individual over the age of 65 who had other medical conditions and passed away at their residence. The number of tests that have been performed in Tippecanoe County for COVID-19 is close to 7,000 at this point. As we've discussed in previous weeks, our demographics remain about the same for our confirmed cases, with the largest percentage occurring in people ages 20 to 29, accounting for 21.6%, followed by the 30 to 39 age group at 19.2%. Our cases are divided fairly evenly, male to female, 50% occurring in white individuals, 10% in African Americans, 20% in Hispanic individuals, and less than 1% in Asian individuals. We're also reporting that we now have a cluster of cases at one of our local nursing homes. Rose Walk Village here in Lafayette has unfortunately had 16 residents and 1 employee test positive for COVID-19. Among the residents, 14 of them are in isolation and being treated at Rose Walk Village. 2 of them are hospitalized. All residents of that facility have been tested, and 20 employees in that facility have been tested. The health department has been in communication with Rose Walk Village to ensure that appropriate infection control measures are in place, and they are indeed in place. The health department, as we've mentioned before, is monitoring several data points with regard to our local COVID-19 situation. The first, of course, is the number of confirmed and suspected COVID-19 cases in our county, and we have been watching the average daily incidence of new cases by week. This number peaked in early May at 12.9 cases per day, and then has dropped subsequently with each week. This week, it is thus far 6.2 cases per day. Of course, the week is not yet over, so we'll be watching that number very closely, especially as the numbers of new cases tend to fluctuate from day to day. Here in our county, 6% of our tests have been positive. This is a little less than the national percent positivity of 6.8% and lower than the state's percentage of 12.9%. Our hospitals are faring well in terms of their numbers of admissions and numbers of intensive care unit admissions for COVID-19. Those numbers are fairly low at this point, with 9 COVID-19 positive patients at St. Elizabeth and 5 at IU, 3 in the intensive care unit at St. Elizabeth and 2 in the intensive care unit at IU. Nobody on a ventilator for COVID-19 at St. Elizabeth, and 2 at IU on ventilator. Our number of ER visits for respiratory illnesses has gone up somewhat this week. It is not as high as it was in April, but is a bit higher this week than it was last week, so we'll be watching that trend very closely. And of course, our last data points that we've been monitoring are the number of deaths due to COVID-19 in our county And as I reported, we have one additional death in the county. Now our total is 4 deaths due to COVID-19. The CDC does report on various models that predict the course of COVID-19 across the United States. They have a summary of 13 models that make predictions about the state of Indiana and where COVID-19 will go in our state. Those models are predicting between 2,500 and 3,300 deaths in the state of Indiana due to COVID-19 by June 22nd. So we'll be watching those numbers very closely. As we've discussed at previous press briefings, it's very important to remember that as our state and community continue to reopen, we need to keep in mind that our COVID-19 pandemic is not over. Although we're seeing some favorable data, we are, of course, still seeing new cases every day. And it's also important to remember that many individuals with COVID-19 are asymptomatic. They have no symptoms at all. Thus, they can easily spread the disease without even knowing it. And for those reasons, we all need to be very vigilant and continue with the approach that we've been emphasizing for the last several months. We need to continue maintaining our social distance of 6 feet when in public settings. We need to be wearing face coverings when in public settings, especially in crowded places where social distancing is difficult. We need to frequently wash or sanitize our hands and disinfect high-touch surfaces. And we should be limiting our social gatherings as directed by Governor Holcomb, which is currently up to 100 people while following social distancing guidelines. Individuals age 65 and older and those with high-risk health conditions should remain at home whenever possible. Businesses that are reopening should modify their operations and their workplace environments to optimize social distancing and protect their customers and employees. Businesses also need to establish plans to regulate their customer capacity per Governor Holcomb's directives, which are currently at 75% and 50% for mall common areas. It's very important that we all not let our guard down now. We need to continue the excellent work that we've all been doing in our community to keep COVID-19 at a relatively low impact here. It's important to remember that with COVID-19, slow and steady is going to win the race. We don't want to rush things at this point. We want to maintain our vigilance and continue to be cautious in what we're doing. The last topic I wanted to address was a topic that I've been asked about several times during these press briefings, and that's local recovery data. One of the things that's been difficult for us to count, has made the counting of recovery difficult, has been the lack of a consistent definition for what is recovery. There is currently no national definition for recovery in COVID-19. Various states use a different set of criteria. The state of Indiana does not have an official criteria for recovery. So one of the things that we're going to be looking at the health department is our own criteria for recovery, and that will include the passage of at least 28 days from the time of diagnosis for individuals who are not in the hospital. And we are in the process of contacting all of the individuals who have been, for whom it's been at least 28 days since their diagnosis, to check in with them and on their status and find out if their symptoms have resolved. Anecdotally, what we have found is that some of those individuals are still symptomatic more than 28 days after their infection. Some of them who had tested positive in the month of March are still experiencing symptoms. So what we've observed is that the recovery from COVID-19 does appear to be a long process involving several weeks, sometimes over a month before recovery. So as that data becomes, as we get more of that data, we'll be sharing that data in future weeks. That concludes all the remarks that I wanted to make today. At this time, I would like to invite Mr. Michael Budd from the United Way to the microphone for an important announcement involving housing.
First, thank you for the opportunity to be here to share this news. We are today announcing the creation of the Tippecanoe COVID-19 Housing Stability Hotline. This is a result of a community collaboration of public and private organizations, nonprofits, that are providing this type of support. And I want to thank the City of Lafayette and Community Foundation of Greater Lafayette of working with the United Way of Greater Lafayette in this project, and also our many partners that have worked on it. Our goal is to help streamline the process for individuals who are seeking housing or utilities assistance, either mortgage or rent, as well as utilities. There have been a number of funds brought to our community from a variety of sources, and it can be a bit confusing, so we're trying to streamline that and make it easier for folks. So starting this Friday, June 5th, at 8 a.m., the line will be active. It'll be between 8 and 6 p.m. Monday through Friday, and we will have professionals from a number of our organizations answering those calls. If someone does call and they get a voicemail, we encourage them to leave a message, and our commitment is to return that call within one business day so that we can get them directed to the resources they need. The other thing I wanted to say is that we are encouraging folks to not wait. There is an embargo on evictions and utilities cutoffs. We'd like for folks to be thinking about that now and getting ahead of it. So we have 3 weeks or 4 weeks before that will become an issue, hopefully, in the community. So we have some time to help people prepare and take the bills that they have building up. The other thing, just wanted to mention that the navigator's role will be to do a quick triage of their situation, and then they will refer them to the right organization to hopefully provide them the best support and the most complete support for what they need. So thank you again for letting me share that news.
Thank you, Mr. Budd.
Michael, I'll just make a quick comment. Thank you very much for what you're doing. The City of Lafayette's proud to be partnering, and I would be remiss if I didn't publicly thank Adam Murphy, a member of our staff who's been involved with this from the very get-go on the process and how the information will work, and is actually helping train the navigators that will be assisting people in our community. So I wanted to thank Adam for all his hard work. So, and thank you and your team for doing this.
Great. At this time, we would like to entertain questions from the media and from our Facebook Live audience.
Hello, this is Anna Darling from WLFI News 18. What is the county health department's kind of response to the protests that we've had and the large gatherings? Many wore masks, many didn't. There was not really much opportunity for social distancing at the large protest that happened on Sunday. What is kind of the health department's response, and what should people do who went to these protests? Should they quarantine? Should they be tested? Any recommendations?
Sure. So certainly, anytime there's a large gathering of people, especially in a situation where social distancing is difficult, where many individuals are not wearing masks, there's of course a risk of transmission of the coronavirus. Also, in a protest situation where people may be chanting or yelling, there's also a higher chance those individuals expelling respiratory droplets that carry COVID-19. So there certainly are concerns with the local protests, just as there are concerns with the protests in other parts of the country. In terms of what individuals who participated in the protests should do is they should monitor themselves for symptoms. And certainly if they begin to develop any symptoms, they should contact their healthcare providers immediately for evaluation. Moving forward, with future protests, future demonstrations, I think it's very important to emphasize that everyone should be wearing face coverings at those events. As we've said before, the face coverings are particularly important in settings where social distancing is difficult to maintain, and certainly a protest or demonstration would be one of those situations. If you are at one of these events and you it's possible to socially distance. Of course, that is also the ideal thing to do, to try to maintain that 6-foot distance between yourself and other individuals. So I think from a public health standpoint, those are the most important things. From a general standpoint, of course, peaceful protesting is always preferable to other forms of protesting, and I think our elected officials would agree with that also.
Yes, yes.
Emily DeLetter, the Journal and Courier. My question is, wondering if you have any guidance for big events that are happening this summer, such as the county fair, and if you're kind of looking ahead toward other events that could be happening in the fall, like sporting events and things like that.
So for the county fair, which is scheduled for July, we did share with the fair board some recommendations that were developed not only by the health department, but also by the Tippecanoe Emergency Management Agency. And it's my understanding that the fair board did meet last Thursday and to decide on how this year's fair would look. And I believe they have released their plans for a scaled back version of the Tippecanoe County 4-H fair. I don't have all the details in front of me to go through those, but it will be a different sort of fair this year on a much smaller scale, and that's unfortunately necessary when we're in the midst of a pandemic. A large event like that could be, of course, a nidus of infection, and so taking whatever steps are necessary to reduce the risk to everybody participating is the right thing to do.
Anna from WLFI. Sorry, Anna from WLFI again. Could you give a timeline on the Rose Walk Village outbreak or cluster? When did that first get reported? How quickly did it spread? And steps moving forward in that situation?
Sure. So we were informed of a staff member there who tested positive, I believe, last Thursday or Friday, and at that point, Rose Walk called in a strike team to have all of their residents tested. As you know, with the testing, there's a 24 to 48 hour time frame to get the results back. So we've we're notified of the results for the residents on Monday, 2 days ago.
Question from Facebook Live. Can a business require people entering to wear masks? If not, why?
Yes, a business can. A business is on private property, and the individuals who own that business can require that their customers wear masks.
Just like it used to be, no shoes, no shirt, no service. Add masks to that list.
Another question from Facebook Live. Where can the phone and contact info be found for the navigators through the COVID assistance through the United Way?
Information about the hotline will be available on United Way's website here in the next day. Number will be released probably tomorrow night or Friday morning. And that's United Way of Greater Lafayette's website. So
The health department will also be sharing that information on their Facebook.
So will the city of Lafayette once they formally release it?
Another question from Facebook Live. Are masks recommended at swimming pools?
So the CDC actually has released some guidance about swimming pools, and masks are recommended when you are around the pool, on the areas around the pool, perhaps just enjoying the sun, whatnot. Obviously, when you're in the pool and swimming, you should not be wearing a face covering. But when you're outside of the pool, and it's a good idea to wear a face covering. Any additional questions?
Here's another question for Facebook Live. Were there specifics of the fourth death as of age or any other specifics?
So the fourth death occurred in an individual over the age of 65 with other medical conditions. The individual did pass away at their residence. If there are no further questions, I would like to thank everybody for attending, and we'll see you next week. Thank you.